Hi, moms. I'm so excited today to introduce you to Dr. Grace Tassa. She is a primary care physician and she has went into private practice with Bespoke Medicine in Beverly Hills. She's also a mom of three and an absolutely amazing doctor. I know because she's my doctor and my daughter's doctors. Dr. Tassa, introduce yourself.
Hi, I'm Dr. Tassa, and it's such an honor to be here today with LaReine and to be a part of Momgevity and helping moms. So I'm really excited to be here. Thank you for the opportunity.
We're so happy to have you. So I just want to ask you a couple questions about what do you think are the most health issues that moms ignore and how they can, see a way through that?
That's a great question. A lot because moms are juggling so much and they're helping their babies and helping their kids and their teens and kind of putting themselves on the back burner. I would say moms tend to ignore the things that creep up on you, but sometimes those are maybe the most important things. So fatigue, irritability, mood changes, weight changes, metabolic health. I would say those are top for what women kind of they don't come in and maybe until they happen to be there for something else and they mention it or things are really at a breaking point.
Yeah. So, Dr. Tassa, when women come in and they're feeling tired and fatigued, usually it leads to a thyroid problem, isn't it? And then how would you address that?
Yes, if someone's coming in and having symptoms of low thyroid, we definitely want to get blood work to see where their thyroid levels are. Symptoms to watch for include anything that's really a sign of a low metabolism. So feeling tired, weight gain that's totally unexpected and not explained otherwise, kind of just moving more slowly, not having the energy to get your things done in your day like you normally would. So we'd want to get a full thyroid panel to start with. And that includes a TSH, T3, and T4. If you were wondering, that's
What that is. Okay.
Yes, yes. And then depending on what those levels show, if they are low, we certainly want to figure out why you're running low. And then at least in the meantime, supplement your thyroid levels so that you're feeling better.
That's amazing because so many women have thyroid issues before baby, after baby, at many different stages in their life. So, and how do you feel that women can build a better relationship with their primary care physician?
Oh yeah, I love that. Really, I would say think of us as part of your team, like a teammate. So I think a lot of people, understandably, they just go to the doctor when they're sick and it's like a one-off thing. But instead, I would try to check in. I mean, certainly go for your wellness visit, but if you have a question or something doesn't feel right, schedule a follow-up, come back in or send a message. Just kind of keep insert yourself in your doctor's mind here and there. And really focusing on those wellness issues, which are so important rather than just coming in when you're sick, but following up on metabolic health, like such as cholesterol and your preventive screenings, checking in with your doctor about these things, and really working with them like they're a teammate.
Yeah, that's a really good point because how do you feel about like functional health, the whole thing? Like, I know that my daughter, who's 23, my oldest one, like they get their blood tested like every 3 months now. So I have a constant marker of where you are. Well, I'm calling that functional health. But I mean, how do you feel about that? Is that
Yes, I mean, I love more information. So if some people are total needle phobes and I can at most, get blood work once a year, but I think checking occasionally because, life is dynamic. We're doing things, blood work changes. It's great to check in every so often and see how things look.
Yeah. Okay, good. And that way you have a baseline and a benchmark for where you're at, if you're before baby, after baby, perimenopause, after menopause. So many conditions, can lead to so many things. So if you know where you were before, then you have a nice baseline.
Yeah,
right?
absolutely.
Okay, great.
Yeah.
All right. So what annual screenings would you prescribe for moms?
Well, mammograms are so important.
Yes.
Typically, we start at age 40 for annual mammograms. So, absolutely mammo. If anyone has any family history of breast cancer, we will often start earlier. Colonoscopy, we start at age 45. But again, family history, we could start earlier. And then, of course, your pap smear. So important to check in regularly with your primary care doctor or gyno for pap smear.
Okay, I'm going to go a little off book and ask you a question now about cholesterol
Yeah.
and statins, because there's been so much, news about statins lately. So how do you feel about those for treating high cholesterol?
Yes, I'm a big fan of statins. There's probably in my mind very few drugs that really like changed medicine and statins are one of them. So they significantly reduce risk of cardiovascular disease and cardiovascular events. Um, there is definitely some negative press on statins, including I think one of the biggest ones is that maybe it increases sugar levels, which is somewhat debated because we do give every individual diabetes a statin. So is it the statin causing high sugar, or do people with high sugar take a statin? It gets a little confusing.
Yeah.
But we know they really decrease risk of somebody having a cardiovascular event, such as a heart attack or stroke. So I think, I mean, it's one of those things, if they could put a little in the drinking water, we'd all be better.
Right. Oh, like fluoride. Yeah, put the fluoride in your teeth. It's a really good idea. Well, you heard it here. Momgevity first. Okay. If you could give moms one takeaway before we go, about their health, what would it be?
Yes, I really love weight training, and I think
Yes.
women, for years we were at a disservice because we were told cardiovascular, hit their treadmills and you would never see a woman weightlifting, at least back in the day. Now I think it's, starting to happen, but muscle mass is so important. It's so good for your health. You get better posture. You can pick up your babies more easily.
That's right.
And then, the more muscle mass you have, the more it improves your bone density, which women really need that. The more bone density, the better. So, any little time you can squeeze in some weightlifting in your day or into your workouts, I highly recommend it.
Wait, work your mommy muscles. Dr. Tassa has a great blog on Momgevity.
Yes.
Work your mommy muscles. It was like one of our best performing blogs.
Thank you.
And then you also mentioned carnitine,
Oh,
right?
creatine. Yes. Yes.
Creatine.
Oh, yes.
Okay.
Creatine. I love creatine. So creatine has been studied ad nauseum. It's safe, so 5 grams a day. It really increases lean body mass, so muscle mass essentially. And there's been no negative side effects found, and there's some studies out there showing it even increases like cognitive processes. So
Wow.
all good things.
That's such a good tip. Well, those are amazing tips that you got today from Dr. Tassa, and she is part of our expert panel. And you can find her on momgevity.net, and with our annual membership, you can contact her, read her blog, and just enjoy all this wonderful information for moms, which is so important. So thank you for being here.
Thank you, LaReine.
And we'll see you soon.